Hello and welcome to Health and Lifestyle, where we are passionate about health matters. Are you concerned about your health or that of your loved ones? Would you like to adopt a healthy lifestyle? Well, this show is for you. In this show today, Jerry Moita tells you not to ignore period pain, and a new technology to operate on endometriosis, and on good practice today, avoid nyamachoma. That's coming up when we'd like to hear from you. Share your ideas and comments on our social media platforms. That is at KBC Channel 1 and at Maria Mo on X. Facebook is KBC Channel 1 TV. And welcome to the program. About 5 to 10% of women of reproductive age, that is about 15 to 49 years, could suffer endometriosis. That's about 190 million women worldwide. And also about 50% of women with endometriosis do suffer infertility. And also, according to the World Health Organization, 50 to 80% of women with pelvic pain could actually be having endometriosis. Jerry Moita's journey with endometriosis sheds more light on the realities of living with endometriosis and the importance of early diagnosis and treatment. Let's get to hear her story. 35-year-old Jerry Moita is an endometriosis survivor. The now mother of one says while her menses were normal, over time she developed excruciating pain.
I had my first period when I was 14. And I remember it, and I was very overjoyed because that time, you're maturing, you're a girl. I had no pain. I never used to have cramps, even the normal cramps you get here on your abdomen. I never used to have them. The first time I experienced pain, ridiculous pain, was in 2010 there. I had shooting, stabbing pain on my back area. That is the bum area. And I remember I visited a gyna. But then that time, endometriosis was not known. I remember I Googled the exact words, shooting, stabbing pain in the bum. And the first thing that came up was endometriosis. And when I told my gyna my symptoms, he said, this actually sounds like endometriosis, but he wasn't sure. So even the tests that he did, the scans, everything, it didn't show. And I don't remember him putting me on any medication. So I just used to take painkillers like Buscopan, and that didn't help as much.
She visited several doctors with no success.
So fast forward to 2015, I was at the coast and my pain was gradually increasing and increasing. I saw a doctor there and he put me on hormonal treatment. It's called Vicene for 6 months. That one relatively helped. And then 2017, I conceived. So of course for that period, I'm not having my menses. And after my maternity, 6 months after when my menses came, I was fine. I didn't have any pain. So come last year, that's when the pain started gradually coming back, slowly by slowly.
Managing the chronic pain was not easy while trying to maintain normalcy in her personal and professional life.
Like now, my schedule, I would always plan it around my period. When I know my period is going to be a certain date, I can't do anything heavy or I can't travel as much. And even sitting down for long hours, it's very uncomfortable. Because imagine you're sitting down and at the same time you're feeling something is stabbing you. You don't want to sit. And you don't want even to have people around you. You're irritated already because you feel like your body is fighting you. Then you have people around you, you can't tell them. Or even if you tell them, they won't understand the pain that you're under. There's a day I didn't go to work. That has never happened for me, ever. I could always bear the pain. Like on a scale of 1 to 10, it would probably be around 5 or 6. And the painkillers that I used to take on a regular would help me. But this time, I couldn't take any painkiller at all. I remember trying to stand, or rather to lift myself up from the bed, and I couldn't. From the waist down, I felt like I was paralyzed. The pain was too much. And I never used to eat when I'm on my menses. I would take light, very light food, like fruits. And watery fruits, like so watermelon, something like that, so that I don't have to think of going to pass stool.
After years of being misunderstood and misdiagnosed, Njeri finally encountered a specialist who took her symptoms seriously.
The first thing they did was a scan, and immediately when he came to the room and was looking at the scan, he told me, "This is where your problem is." He told me I had an endometrial nodule that had attached itself to my bowel. Now when you're passing stool, there's friction that is moving there, okay? Your stool is coming out from your rectum, then you have this endometrial nodule that is attached to the bowel, and you're also bleeding during your menses. So there's a lot of friction there. The pain it's out of this world.
As Njeri's condition progressed, her treatment options became more limited. She was faced with the decision of undergoing a major surgery in hope of a better quality of life. So right now, there are 2 surgeries which are going on, patients who are undergoing endometriosis surgery. Now, this surgery can take up to 11 hours depending on the complications of the patient. And after the surgery, Njeri says she felt immediate relief.
I always used to associate pain with my period. It's only last night that I knew, wow, my period has come. I'm not in pain. I can't remember the last time that happened, ever. I can't, maybe when I was 14, when I first started. Yeah.
Reflecting on her journey, Njeri has embarked on a new chapter of her life, focusing on her wellness and using her experience to empower others facing similar challenges.
Those myths of period pain and ni kawaida, it's not kawaida. If it was kawaida, then I wouldn't be here. I wouldn't have come for surgery. I would have gone along with my life and it would have been normal. But then, there's even the slightest pain that goes from normal to abnormal. You need to have that checked out. And the good thing is that endometriosis now, people are getting to be aware.
And this is her word of caution.
And even for parents, please listen to your daughter when they tell you, "I'm in pain." Si kawaida, and don't say vumilia. It's not. And for people who have conceived, for women who've conceived, and then they're told that after you give birth, during your maternity, everything will go back to being well. I was there. And look at me now. I had surgery a few days ago. Yeah, so the pain doesn't go away even if you have a baby or 2. Maybe for some it will, for some it won't. But if at all it doesn't go away for you, please see a doctor and address these things before it's too late.
So we wanted to gauge public knowledge on endometriosis. Let's get to hear their reactions on the streets.
I've heard about it. I haven't experienced endometriosis personally, but I've known people who have had it.
Really, I've not, but I've seen it in TikTok, and they really say that the cramps come in pain, and then there is an overflow of the blood. Yeah. Plus, niliskia like in our affect their sexual life.
Actually, I've not heard about it. It's when I'm hearing it for the first time.
It's not supposed to happen. It happens to women when the cells of the uterus, I guess, they grow outside the uterus. Yeah.
Doctors have described endometriosis as an enigma and a disease of the 21st century. I began by asking Dr. Devan Jagol, who is a bowel endometriosis surgeon from India, how this condition forms.
Simple language, if we convert, that is the menstrual blood collection outside the uterus. That's what we say. That's in simple language. The gland which produces menstrual blood, the same gland grow outside the uterus. And that's called as endometriosis. Endometriosis is the gland which forms or which makes menses. The same glands, they grow outside the uterus somewhere because of some reason. That is known as endometriosis.
Okay. What's the cause then?
Cause, as of now, if you say cause is not 100% known. Even if we are in 21st century, this era where we say that, the transplants and all the good hi-fi things are going on, but still that's why we know that we say that endometriosis is an enigma. So cause as of now, but yes, there are a few modalities with which you can diagnose it, like good sonography, good MRI, good history taking and all. And there are specialized centers, specialized doctors who can operate it and give best result.
So endometriosis can affect different parts of the body. Can you explain to us which other parts of the endometriosis can spread into?
Anywhere. There are reported cases of endometriosis in the brain. So it can go anywhere. But mostly what we see is endometriosis usually affects uterus itself because it invades inside the uterus. That is one. Second, it can invade into the bladder, bowel, ureterus. So these are the most common area where you can see it, and ovaries and fallopian tube.
What are some of the side effects of having endometriosis?
Main side effect what we usually see and what we usually think that we should treat is pain. So severe pain during menses, that's one of the most important and most common cause of endometriosis. Then associated things are, female cannot get pregnant because there is infertility because of endometriosis. Then it goes on and on. A female, she is having difficulty in passing urine, difficulty in passing stool, difficulty in having intercourse. So that all things are associated.
So endometriosis affects a lot of women within the reproductive age. But what we've seen sometimes in our local setup is that when a girl starts having her menses and they're very painful, so they're told, you'll wait and the pain will just go away. But is it possible to diagnose endometriosis early enough?
The main problem is when a young girl gets menses and she is in pain, people say, oh, it will go away after some time. When at the reproductive age, the married female gets menses and she is in pain, people say, oh, there will be one child, and after that, that pregnancy, you will be free of pain. So it is not so. You have to target her complaints. If patient is complaining you for some particular things, you have to target it. And you have to have that particular mind thinking of endometriosis. That's what we want to convey our message to gynecologists, because gynecologists are the one whom patient will come first for her such kind of complaints. So he or she have to have that vision of diagnosis endometriosis early, so we can treat her early, and the problem which goes up till the high end thing will be less, because ultimately it is when patient comes to you by the time 5, 6, 7 years.
So what message do you have to the Kenyan women in as far as catching this particular condition early enough? What would you tell them?
What I would like to say is, if you have any symptoms, go and approach to your gynecologist for such kind of symptoms. Any such kind of symptoms like dyspareunia, that is pain while intercourse, pain while menses, having menses, pain while passing stool during menses, pain while passing urine during menses, such kind of symptoms, if you have, go and share this information to your gynecologist, because you may have endometriosis and it is treatable disease. It is not like something, it is not cancer. So frequent visit should be there, and gynecologists should have proper knowledge about endometriosis.
We also attended an endometriosis medical camp at the Third Park Hospital here in Nairobi, where international and local doctors exchanged expertise.
I come from the northeast part of India, and I am a specialist in endometriosis, dealing especially with bowel endometriosis and bladder endometriosis. In short, we call it deep endometriosis. We are the excisional surgeon for that.
The endometriosis medical camp brought together doctors from Kenya and India to offer subsidized surgery for 11 women from Kenya.
So this workshop is specifically targeting deep endometriosis, where even yesterday we've operated 3 cases of bowel endometriosis. 1 bowel endometriosis is already going on, and I am about to start the 2nd bowel endometriosis. So it is not an uncommon disease. If you see about 13 to 40% of women who suffer from endometriosis, approximately 12% have bowel endometriosis. So it's not a small number. It is to be addressed, and the history has to be taken carefully about the symptom of the patient, and surgery is the only option. There is no role of medical management when the disease affects your organs besides your reproductive organs.
So we use a lot of workpiece for how we will open surgery.
The medical camp was also a time for the doctors to learn from one another.
Dr. Yamal and his team has invited us all the way from India so that we could do some benefit to the doctors here as well, because our target is to create awareness and teach whatever we have learned through time so that the local doctors can also pick up, because this set of surgical skills very few people have acquired. It's not that we are born with it, even we have acquired it going through to various training places and of course doing our homework regularly. So our target of this workshop is so that we can train other doctors today, because there are a lot of doctors in the theatre who are probably dealing or getting patients of endometriosis day in and day out. But only when you know the depth of the disease, you can cure a patient completely.
So now what we'll do is we'll further mobilize the ureter from this page.
His goal today is not only to conduct endometriosis surgery, but demonstrate how to use laparoscopy, an operation performed in the abdomen or pelvis using small incisions with the aid of a camera to perform endometriosis surgery.
We do majority of the surgery exclusively by laparoscopy, so that the patient benefits more and the surgery is more accurate with laparoscopy and the recovery is really good. As an open surgery in today's era has no role in endometriosis.
Be careful, don't be overconfident, cut only what you can see.
During the surgeries, Dr. Decker was keen to explain the process for best results.
Push, push, open, push. Can you see this rectum here? Yes. Can you appreciate it? Yes. Simple movements. Push, open, push. Push, open, push.
One key skill, however, he says, is for the doctors to be able to identify the disease during routine consultations.
So our target today is in this workshop is to teach the doctors how to pick it up by routine ultrasounds, and then how to go about the management, because you need a multidisciplinary team, and then finally how to surgically excise it, because surgery is one part of the management. The majority is picking it up and the post-op, so that your post-op is not eventful.
And it's not only the expertise that matters. Dr. Yamal Patel offers insights into the complexities of endometriosis surgery. He also explains how the use of 3D technology is enhancing the outcome for patients.
And in terms of surgery, this is a very complex disease that is obviously riddled with lots of possible complications, because you're talking of bowel, bladder, ureter, kidneys, so you have to be very careful. Until recently, yes, I mean, if you want to get a complete excision type of surgery, many of these patients were even traveling out of the country. And now we have this full-fledged facilities available here. At Third Park Hospital, we do have 3D laparoscopy, which really aids in complete excision of these type of surgeries. We are doing 11 surgeries over the next 3 days. And we've already done 4. We are starting with the 5th one, where all of them had bowel disease and did require bowel procedures. This center is also a specialized multidisciplinary center for endometriosis. So what we mean by multidisciplinary, endometriosis is best handled as a team. So we have the endometriosis surgeons who are gynecologists, specialized in advanced minimal invasive surgery. We have colorectal surgeons, we have pain specialists, we have psychiatrists, we have physiotherapists, we have gastroenterologists, we have urologists, we have advanced nurses who deal with this, and we have support group people as well. We also have a cardiothoracic surgeon who deals with the endometriosis of the lungs, for example. So this is what constitutes a full team of endometriosis.
So surgery seems to be the only option for women suffering from endometriosis. So what's happening right now is that the doctors are using a 3D technology to conduct endometriosis surgery on this particular patient.
Yes, so what's going on is a detailed endometriosis excision surgery at the moment. We are proceeding with hysterectomy for this patient because of severe endometriosis. As you can see behind, it has involved the bowel and pulled it in. It has pulled in the appendix. It's a big mass now. There is a big endometriotic cyst in the ovary. There are fibroids, there's adenomyosis. So everything just gets pulled in and becomes a mass. So what is going on now is using 3D technology, which is why I'm wearing these glasses. Using 3D technology, this patient is undergoing a laparoscopic excision of the endometriosis. 3D helps us with the depth and the distance. So without 3D, you will see things in 2D, which makes it difficult to appreciate depth. So for extensive surgeries like endometriosis, 3D laparoscopy changes the whole game. In terms of success, yes, I would say this will be 100% successful. There's a guarantee that this patient will be completely pain-free at the end of it, given the way we are doing it at the moment. Being laparoscopic, the recovery phase is much faster. This patient, depending on what we do, might stay in the hospital for just 1 day, sometimes max 2 days if we have to do bowel. And recovery in terms of pain, in terms of scarring, in terms of healing would be much faster. But complete healing is still considered up to 4 to 6 weeks. So that's what 3D helps with. It gives us, when we're going very minute structures, it gives us the depth between two structures.
In the Good Practice segment, we talk about how you can adapt a healthy lifestyle to manage endometriosis. And what are some of those habits that you can adapt? Definitely diet plays a very big role. Eat more fruits and vegetables. Whole grains like rice, things like whole maize are good. Beans, dengu are also very good in as far as whole grains are concerned. Healthy fats like olive oil, coconut oil are very healthy, and also, avocado oil and nuts can also play a big role in managing your endometriosis. Definitely limits your intake of red meats and also processed foods. Those are some of the healthy habits that you can adapt in as far as managing your endometriosis. Remember, the endometriosis is actually increased as a result of inflammation, and so these kind of foods can help you reduce period pain and also inflammation. Number 2, increase your intake of omega-3 fatty acids, and these have anti-inflammatory properties, and they're shown to reduce period pain. Fatty fish like Nile perch, that is mbuta, tuna, and even tilapia are some of the foods that you can actually inculcate in your diet to help you with managing anti-inflammatory, side effects of endometriosis. Other animal and plant sources are like flax seeds, chia seeds, flaxseed oil, pumpkin seeds, peanuts, that is njugu, macadamia nuts, and even hazelnuts. And number 3, last but not least, is definitely having some movements. Inculcating some physical activity, exercises definitely helps with overall health. Things like taking a walk or even swimming, biking are some of the exercises that you can inculcate. At least 30 minutes of exercise is what the World Health Organization recommends for adults each day, at least for 5 days. That's it for the program today. Thank you so much for your time. On behalf of everyone who made this program possible, we say thank you. If you've missed any part of this program, head to our social media platforms, our YouTube channel, KBC Channel 1, to get more details. And remember, while there, like, share, and comment. We'd also like to hear your ideas about what topics you'd want us to cover. My name is Marie Yambo. Until next time, it's bye for now.